slideshow. There we go. So I'm hoping everybody can see that. John, can you see that okay?
Yep, perfect.
All right, good. Okay, I think we're ready to roll. Well, thank you everybody for joining us today. And before I really dive in here, I want to just take a second to just thank MCH for putting this together and thank every single one of you that's attending. Thank you for taking the time out to be here. This is a challenging time for everybody, but in MCH in particular, I think it would have been easy to just call off everything for the year, but you guys have risen to the occasion and dove in and created a really great resource this week. So thank you for doing that. Thank you for taking the time to create this this learning week for everybody. And thanks for the opportunity to talk about some of the changes, the housing support and MSA programs, but then weaving in some of the changes that hopefully will be helpful resources for people over the next months and years. So I'm going to dive in here. And the starting point, I think, for talking about both of these benefits is to really look at them in context of the housing system in general. And the starting point is always just really basic. A person, we need to get people into housing, just like the Lieutenant Governor just said. Housing, I like the way she said it. And housing ends homelessness, but shelter saves lives. And this is the ultimate goal, is to help to see people get into a safe place and then transition quickly, either directly into permanent supportive housing or to go through shelter, some sort of emergency shelter, and then transition into permanent supportive housing. So every single person that is that's in this situation, that's sort of going through this process of getting into housing, they present to their housing situation with a bunch of different life factors, and those look different for everybody. They look different for you and I. And everybody kind of comes to their housing situation with a different set of resources, different service need, preferences about where they live, which inform the housing options that they have. Some people have enough money to self-pay. A lot of people don't. And there are federal resources and other state resources that are really targeted. And oftentimes those are really finite resources that run out, either based on having a limited number of vouchers or subsidies, or a limited pool of grant funding for a particular thing. There is the message and the context for the presentation today is that there are a couple of things that are not finite resources, that are public benefits that are available in Minnesota that can help people pay for their basic housing expenses. And those two programs are housing support and MSA housing assistance. And that's where John and I come in today, is to talk about the structure of each of those programs and how people can access those programs. And then my section in particular has a heavy interaction with providers and places. So I'll be talking about how the housing support program interacts with providers who are providing the service and the places where it's okay to do that. So that's on the housing side. That's where housing support and MSA housing sit as part of our public benefit system. Most people who are going into some sort of supportive housing situation, they need to have some sort of supports or services that are in place. There's a wide menu of those that are available for people, and an increasingly wide menu, I would say. And some of them are really specific to people who are experiencing homelessness. Some of them really start with the lens of a person's disability. Some of them start with the lens of a person's of a specific diagnosis of having a mental illness. Lots of different types of services that are available for people. Housing support in particular has a service or service funding that can come along with the housing support room and board. So that is one of the services that we'll be talking about today. That sometimes is unlimited if you're serving a person who's experiencing or who has experienced long-term homelessness. Sometimes it might be a little bit more finite if it's based on a county's historical service capacity to assign some service capacity to a particular project. But just know that housing support has room and board piece, and then it has a service piece. The one thing that we won't be talking about in depth today, but is a really important placeholder in your mind as we're thinking through some of the programs, and as we talk about transitions today, is the Housing Stabilization Services Program. Really important to know that that is new and brand new and super unique in Minnesota, and super exciting, because this is we are the first state in the country to have Medicaid funded supportive housing resources that are really specifically based on a person's housing instability, not necessarily based on having a certified disability. So the short version of this that people need to understand is that we've had some similar services that could support people in finding and keeping their housing that were MA funded, but they were locked up inside this waiver. And so that means that people had to have a certified disability to be able to access that. And what is true now is that those services are no longer locked up inside the waiver. They're part of the Medicaid state plan. So anybody who is eligible in Minnesota can get access as long as they're eligible for that service. They can a person without a certified disability can get access to supportive housing resources. So the message is the menu of options to support people in their housing or in accessing and maintaining their housing is substantially bigger just because that's included in the state plan. So just keep that in mind, and that's just sort of part of your planning as you're thinking about tools in your toolbox to serve people. Or if you're a person who's experiencing homelessness or getting into housing, this is something that might be available to you to be able to find out more about a service that can help you stay stable in your housing. So this is the kind of the universe that we're operating in here is public benefits that can pay for your housing. It can help you pay for your housing, and two separate benefits. And I'm going to talk first about the housing support program, and then John's going to come up later and talk about the MSA and the nuts and bolts of each of those. So to start with housing support is an income supplement so that means that the state of Minnesota is adding some money on top of what a person has. So people have to pay something in if they have it, but if a person doesn't have any income, then the state's going to pick up the whole tab. So this is the super basic illustration of how the housing support program works. If a person has some countable income, they have to pay it in, but they don't have to have that as long as they're eligible for the program. That line where the blue and the green meet, that can go all the way down, and it could be all blue, and the state might pick up the whole tab. Or a person might have some countable income, and it starts to increase over time, and they might have to start paying something in. And that'll become really relevant as we look at where we engage people who are experiencing homelessness and maybe have no income. And as their income increases, there might be something else that's a better fit. And that's where John comes in later to talk about MSA housing assistance. Because for a lot of folks, housing support might be one stop on a pathway or a trajectory through their housing situation. So it's really important to know that it doesn't necessarily have to be static. These can be dynamic situations for people. So starting with thinking about people with zero income or really low income, people pay something in for their housing support, and then the state picks up the rest. Housing support is all state funded. There's no federal funding in the housing support program. It always pays for room and board, and most of the time the room and board rate, and we'll get into the details about what that actually means when we look at our standards in just a minute, but always there's a room and board piece. And that rate, the total rate between what a person pays and the state pays, if you combine those together, that's always going to add up to $934. Almost all the time, it's going to add up to $934. And so that money goes towards room and board, and that's where providers get some funding to do a job that's really specific for people. Sometimes there's some supplemental services that are available for people, particularly when you're serving people who are long-term homeless. If there's a provider in the picture who has an agreement to do this type of work, there's supplemental service rate funding that can be part of that situation, part of that mix of funding to support people in that particular program as it relates to the basic supportive services that they need. And I should note too that there will be in July of 2021, there will be a rate reduction. You see the rate there of $482.84. Not for everybody, but for certain providers. And this would be our long-term homeless supportive housing providers and for our Metro demonstration project providers. Those are the two main categories that are going to be impacted by a rate reduction. The reason that there's a rate reduction is because there is now a new service that's available, the Medicaid housing stabilization services that are available for people. And it actually pays more for the same services that you're providing already. So we're not, the rate is not being reduced by 100%, but there is some, and because it's not 100% duplicative, but part of it is. So there's a little bit of nuance to talk through that. If you have questions about it, let us know. But just know that the rate there, 483, there are some providers who are providing long-term homeless supportive housing services are going to experience a rate reduction, but in at the end of that trajectory, there'll be an actual upside or benefit to those providers because the rate at which they're reimbursed through the new Medicaid services is higher. Some real basic nuts and bolts about the housing support program. People have to apply. This does not happen automatically. This is something that people go to their county or their tribal human services agency and say, hey, I'm needing some support, or they might do this in partnership with a provider that's helping them. And oftentimes that might be you as either whether outreach or whether you're a housing support provider. Oftentimes people need some help with figuring out where to apply, figuring out how to fill out the paperwork. But bottom line is the funding does not turn on unless people apply for it, because it's one of our public benefits, along with general assistance and MSA and MFIP. All those programs are part of our public benefit system that are that are turned on only after people apply for it. John has a picture later of the combined application form. That's the main form that people use to apply usually. But if people are already on another cash program, they can use what's called a change report form, or always it's an option for people to go to the applymn.org website. People, when they apply for housing support, people might also have to apply for other programs. If the financial worker that is looking at their application looks at the information that they're presented with, and it appears that that person might be eligible for another benefit, then the financial worker can require people, based on not just the financial worker's requirement, but based on our state law, that people might need to apply for a benefit, other benefits that they might be eligible for. However, it is okay for financial workers to put in what we would call a good cause exception if it's not the right time for that person to be applying. A great example of that would be for somebody who appears to be permanently disabled. They probably should be applying for RSDI and SSI, but maybe that person is really symptomatic right now, and maybe they're not able to navigate that process. That's okay. A financial worker can put in that good cause exception. Another great thing to keep in mind here is if you're engaging with somebody who is hearing that they need to apply, don't go and don't have that person apply for SSI on their own, or to find another 2 a.m. law firm advertisement for them to apply for Social Security. It's really important to get people engaged through the Disability Hub at DHS. Call that Disability Hub number and help people can get engaged with a SOAR or SSI advocate that can help them with that application process. And they can also help people know when it's not the right time to apply. And to bring that full circle, they can also help the financial worker know that it's really not a good time for that person to apply for that benefit, and resulting in a good cause exception. When people are receiving housing support, they need to report their changes within 10 days. Things like moving in, moving out, income increasing, income stopping, household change. Well, not really so much household changes with housing support, but changes that might impact their benefits. People need to report those changes. And then the last thing to know is that people can be absent and not lose their housing. It can't go forever though. People can be absent for up to 18 days at a time. This is a really nuanced piece of our program. So sometimes, being gone for 1 or 2 days might not necessarily be an absence. It's really about when a person is gone for a particular reason, maybe like hospitalization, or maybe maybe somebody's going on vacation or something like that. The state's intent is to keep those benefits flowing for up to 18 days at a time, and then up to 60 days in a year without people losing housing. So if there are questions that come up about that if you're serving a person and there's a question about an absence and it feels like it's unclear, then let us know and we can certainly help clarify that. This is a real basic model of what the program looks like. It is, you can see a theme here, and I'm going to just I'm going to talk about this in a second, but you can see there's a person and a provider and a place. So all three of those things always have to be true for housing support. And I'll show talk in detail about each of those in just a minute. But you can see that there's a person who is, they have no income, they have nothing else coming in, and because they have no other income coming in, they're going to be eligible for general assistance. That will go right to the person. Nobody else is touching that income. They'll be eligible for GA, and GA is $104 in personal needs for that person when they're receiving housing support. You know, if the person's in the community receiving GA and not on housing support, it would be 203. That's reduced for people when they're receiving housing support to 104. The reason for the reduction is they're getting a whole lot of other benefits to take care of their basic housing needs. So for this person, they have got, they're eligible for housing support and they don't have any other income. So the state's picking up the whole tab and that goes to a provider. And then the provider does their job of making sure, and this is like a traditional group setting where a person might be like in a boarding lodge or something like that. The provider's turning that around and taking care of the food, paying the operational cost and staff that's all associated with the housing support program that they're in. This is an example of what that might look like in the community. A person in the community is not in a place where meals are necessarily going to be provided for them, so they're going to be eligible for SNAP. And then the same scenario, this person has no other income. The state's picking up the general assistance tab for the person, and they're picking up all the room and board for that person to go right to the provider. The provider takes that money and they do the job that's required for housing support, which is this job description over here on the right. And you can see the theme again here. There's a person, a provider, and a place. And that's a really important thing to think about as we talk through the program. That's where we're going to dive in here. And that the rest of my time is sort of laid out in with talking about things in that order, that we have three things that always have to be true. There's a person, a provider, and a place that are always in place for a functioning housing support situation. So let's start with an eligible person. This is an income supplement, so people have to have low income and assets. That's sort of a given, and we'll talk about what that number is in just a minute. And then people have to have what's called a basis of eligibility, or they have to meet one of these criteria that are sort of buried into that paragraph. So I'm going to get into those and what those operationally mean, or translate that into something more meaningful. So first, income. People have to have countable income that's less than the maximum benefit. So another way to say that is you need to at least need $1 of housing support. So a person still has eligibility for housing support in terms of their income as long as they need $1. So they might have countable income of $900. They'd still be eligible for housing support. Is that the best fit for the person? Maybe, maybe not. It depends on the situation for that particular person, but they're still eligible. So they don't have to take it if there's something that's better, but they don't lose their eligibility based on having increasing income. And that becomes really important when we talk about people working, which is really an important piece. Assets have to be less than $10,000. That is the same for all of our cash programs in Minnesota. It's really important to know, though, that people need to interact or think about in their interactions with their assets with other benefits that they might have, particularly SSI. When people do get SSI, they need to pay attention to the SSI asset limit of $2,000. People on MA, lots of people on MA have an asset limit of $3,000. So it's not universal for every DHS program or for all federal programs, but for all of our Minnesota cash programs, the asset limit is $10,000. So that's income. Now let's look at what the basis of eligibility means. A basis of eligibility, it means a verified reason to receive the benefit. So those bases of eligibility, let's break those down. If you're 65 or older, you have a basis of eligibility. We still have to look at your income, but you are 65 or older. That is in itself a basis of eligibility for housing support. If you have a certified disability, you have a basis of eligibility for housing support. And a certified disability is either like SSI or being SMRTed, the state medical review team, or RSDI. Those are like an official federal or state stamp of approval that certifies that a person has a disabling condition that's expected to last a certain amount of time. A disabling condition is also a basis of eligibility, and we use a lot of the same conditions that general assistance uses. And those are all those, for a person to receive housing support, those have to be verified by somebody. And we typically would say that that would have to come through the professional statement of need. It could also come from a medical opinion form. that is used for GA. So either one of those forms is okay, but that has to be, no matter what, it has to be verified by a qualified professional, or a county designee can also fill out the professional statement of need form. And that a county designee is sort of like a relief valve when a person is, maybe they don't have their own qualified professional, but they need to get into housing right away. Counties and tribes can designate a person to say, hey, here's our person, to um, attest to the fact that this person needs to receive housing support and that they meet one of the criteria for the housing support program. So that, and that's not intended to be permanent. It's just intended to make sure that there's a way for people to get right into housing if they need to. There's a new basis of eligibility that is brand new from July of this year. It's called the Transition from Residential Treatment Basis. And this is very specifically a temporary basis of eligibility for people who are leaving residential behavioral health treatment. So if I am in an IRTS, or if I'm in a crisis mental health facility, or if I'm in SUD treatment and I'm leaving and I don't have stable housing, the treatment staff can essentially create a basis of eligibility for me by filling out the professional statement of need in a particular section that says, hey, Jeremy's leaving our residential treatment facility without stable housing, so he needs to receive housing support. Now, that housing support doesn't last forever. It only lasts up to 3 months. But what that does is it creates a soft landing spot. The reason this was created is that we have data that shows that there's a lot of people that end up leaving residential behavioral health treatment into homelessness, or they return to homelessness. And there's just no reason for that. So what we want, there's no good reason for that, because we are at a point of engagement with that person when they're in treatment. So we want people to have a way to get right from residential treatment into a housing support location. They may not use it forever, and they may have to apply for traditional housing support if they're going to continue to use it after that up to 3 month period. So what we don't know the long-term picture, but at least for a person who is leaving residential behavioral health treatment with documented housing instability, they can have housing support turned on. Might not be the first month, might not be for a full month. It might be for a partial month plus 2 months. And then the person has to make a decision. Okay, am I going to stay in the same place and use and sort of reapply for housing support or traditional housing support in the same place? Or is there a better place for me to live that's not transitional, that where I want to be in permanent housing? Let's say I end up in like a board and lodge first, and I want to get into permanent supportive housing. That would be okay. It also is, I want to be clear, it doesn't require that people go through a transitional place to while they're using that transitional basis of eligibility. It's just the basis of eligibility that's not permanent. So the third option for a person would be, hey, there's something better altogether that works better for me. Maybe I have access to a voucher or subsidy, or maybe I'm an SSI recipient and I want to go straight to MSA housing assistance that John's going to talk about in a little while. That would also be okay. What this basis of eligibility does is it creates a little breathing room for a person to not leave the residential behavioral health treatment into homelessness without a way to pay for housing. And we're not looking at any income for that person during that time period. That's a really important point to know, is that for that 3 month period or up to 3 month period, we're not looking at that person's countable income. The state's picking up the whole tab for housing during that time. That's why it's not a permanent basis. It's just for up to 3 months to create that spot for that person to have a soft landing after treatment. This, I've mentioned a couple times, the professional statement of need. That's the form that is used to document most of the eligibility for housing support. It's used for a couple of different reasons. One is for basic program eligibility for people without a certified disability. So if I don't have SSI, I need to show that I'm eligible for housing support. That's where it might happen. Qualified professional can fill out that professional statement of need, even if they don't fill out any other sections but the basic section, and create the documentation that person needs that is eligible for housing support. Or I shouldn't say just the basic section, the sections that relate to housing support. That creates eligibility for our basic program. It also creates the eligibility for our supplemental services that we'll talk about in a minute. If somebody needs to get the supplemental services, they have to have a professional statement of need that shows that they need to get at least 2 of the 4 services that are available through housing support. The last use of the professional statement of need as it relates to housing support is that new transition from residential treatment basis. There is a specific box on that form that that the residential treatment staff can go and complete, and that's what creates the eligibility for that person for that new transition from residential treatment basis. The professional statement of need is also used for our new Medicaid housing stabilization services. That's one of the pathways into the new MA housing stabilization services. I'm not saying that very clearly, but that is the one of the eligibility forms for that. So one thing that I want to just cover is some of the things that you might hear from people if you're either a person who's thinking about using housing support, or you're a provider who is doing outreach with people or trying to engage them in ways to pay for housing. One of the perceptions based on our history as a program is about housing support and work. Either that I'm not allowed to work while I'm on housing support, or that I have to give up every dollar. Well, it's never technically been not allowed to do either one of those, or based on either one of those. Like, it's not a program restriction, and people haven't had to give up every dollar. People could save some stuff, but it was super, super wonky and really narrow. So effectively, there was no incentive. And on an ongoing basis, if you saved up enough money, you wouldn't be able to save up a whole lot of money, and you really lost almost all your income. We don't do that anymore. So really, it's not true. People can work, and they can keep over half of their job income while they're receiving housing support. It's really, the world has changed. If you haven't engaged with housing support, or if people have old perceptions about housing support, make sure that they know that there's new rules. The new asset limit of $10,000 is one of those work incentives. It makes it really possible for people to save up some money and get back on their own feet eventually, or to have money to set aside to pay for other, if they want to move into another location, whatever it is, their asset limit is higher. Again, SSI recipients need to follow those SSI rules. We look at the really important pieces. The last two is that we calculate earned income way differently than we used to. We do not, it's not a dollar for dollar anymore. It used to be dollar for dollar. Now we do the same thing that SSI does. People can earn some money, and then we apply the same disregards, and I'll show you a calculation that sort of translates that in just a second. But the message is people can keep well over half of their income in their pocket while they're receiving housing support. We also made reporting quite a bit easier. It used to be really tricky to report, and providers kind of probably had some would disincentivize work for people, because the messaging was kind of a little wonky, because providers weren't getting paid till way later. That's not the case anymore. Now people report their earned income when they start working, and then the financial worker makes a projection of what their income is going to be for the next 6-month period. The first period might be a little bit shorter to line up with other programs, and they might have to report still for other programs, but for housing support, there's going to be no impact if their income goes up during that 6-month period. They will be set at one level, or one projected income for the next 6 months, unless their income goes down. So it's intended to work in a person's favor. If the income goes up, good for you. You keep the extra income, and then we'll true up in 6 months when we do the next recertification. If your income goes down, let us know, and we will adjust your benefits so that next month you don't have to pay as much. So it's really important to know that for these 3 reasons, it's really, really doable for people to work. This is an example of the value. The bottom line is that people always end up on the upside when they start working. So if they want to, they should start working. I'd say it's right around 275. This is just a basic example. So every person's situation is a little bit different, but about 275 gross in gross income is the spot where people would start to have to pay in $1 to the program.
Hey, Jeremy, can I interrupt you with a question?
Yeah,
this is a good time to ask this question that came in.
Yeah.
This is from one of the attendees. To clarify, if someone has countable income of greater than 984, would they not be eligible for housing support? Would they just pay a greater percentage of their income and be able to keep their bed? And I think you're getting to that in this example, but can you talk about that?
Yeah, you bet. Yeah, once a person has countable income that is over the room and board rate for a particular place, that 934, and I'm sorry if wasn't clear enough about that. If the room and board rate is set at 934, or if it's higher, it could be much higher for a person that's living in a place that has a supplemental service rate. Their eligibility is based on the maximum rate in that place. So it's true that if the room and board rate is 934 and the person's countable income is over 934, then they're not going to be eligible for the housing support room and board payment. When a person is working, and this is a good scenario to think about this, is you can see what this person's the ceiling for earned income. So you can see this example. This person has to pay in about $1 in income, and they're making $275. This person has to pay in about $933 in income, but they're making quite a significant chunk. Now, is that going to be the best fit for everybody? Maybe not. But what that shows is this person they have $933 of countable income. They still need $1 of housing support, so they're still eligible. Now, if this person made a little bit more, or if they're unearned income, because these deductions, the earned income deduction only applies to earned income. If a person has unearned income that is over 934, then they're not going to be eligible for the program. So hopefully that answers the question they were asking, John. This is the example of what this looks like for a person. Going back to our the same flow chart from before, this is what it looks like for a person who has some earned income. If you translate about 525 gross, that person has to pay in about 125 or 126 bucks a month. The state picks up the rest for that person, and then that person has some money left over in their pocket that they can use for whatever they want. That's their money to use. They don't have to contribute that to the program. And then the provider does the exact same thing that they would always do to ensure that these standards over here are met. So the first section that we talked about is eligible person. And we can come back to that if there's questions at the end of it. I'll pause at the end of my section and see if there's any other questions. And then this next section is to talk about what it means to be an eligible provider. You cannot be an eligible provider unless you have what's called a housing support agreement with a county or tribe. And that housing support agreement is really important because it determines all the nuts and bolts of the rates and the number of people you can serve and what type of provider you are. So if you're a provider if you are a supportive housing provider that's not already a housing support provider and you're interested, this is the starting point for you, is thinking about the housing support agreement. Those are all done at the county or tribal level. Those are not done with DHS. And I'll give you a couple of tips in just a second if you need to get started or want to get started with getting connected to a county or tribe. But the thing that's important about this agreement is it includes all of our standards. And the most important standards that are built into the housing support agreement are the room and board standards. And you saw on those flow charts moving from left to right, on the far right-hand side, that's the job description for providers. This is what is written in our state statute, or this is a sort of a plain language version of what's written in our state statute that's required. So if a housing support provider is receiving those funds on behalf of a person, they have a really specific job to do to ensure that certain things happen. And it's really, the phrase ensuring provision of is a really important phrase. And this applies across the board to everybody who's receiving housing support. The housing support provider's job is to ensure that certain things are happening, ensuring 3 nutritional meals a day. The way that happens can look way different depending on the place. So that might not always be a sort of a congregate meal type or a institutional dining setup. It might be that a person has SNAP access, and that's the way that a provider ensures provision of. So that's the lens to put on how providers meet the room and board standards, is ensuring provision of the standards. We also have a set of supplemental service rate standards that requires for any provider that's receiving supplemental service rate to connect the people with the resources that are identified on the professional statement of need. Remember, everybody that's going to get supplemental services, they have to have the professional statement of need form that documents that. And the job of providers is making sure that people get connected with those resources that are identified. That doesn't mean that housing support providers that provide supplemental services have to be or do every single one of those things. They are connecting. We're housing support providers that are billing for supplemental services are connectors, sometimes providers of a direct service, but also they're connectors to a resource, and they have to document those that those connections are happening in case notes. So if you're not a provider yet of housing support, room and board, or services, the first thing to do is you need to understand what's in the housing support agreement. Let us know if you want to get a copy of that. It's no problem getting a copy of it. That is where the standards are really laid out, and it's bigger. There are more nuts and bolts that are required than just the housing support standards. There's some staff qualifications and things like that, because we're a program that has historically didn't have any minimum staff qualifications. Those were built in a few years ago and are also in the agreement. The first step for you would be to get in touch with the right person at the county or tribe, and we can help with that. And then counties and tribes have their own process. So you need to be in sync as a provider with what is the county or tribal process that I need to follow. I do have a monthly training, or we at DHS have a monthly training that's a little bit more, takes a little bit more time to get into some of the nuance of the program. If you're ever interested in that, let us know as well, and we can put you on that mailing list. And in that training, we go into a little bit more detail about getting in the right stream for providers that are looking to get started. So we've talked about eligible people, eligible providers, and now let's talk about eligible places. So housing support can't just happen anywhere. It is very flexible where it can happen, but every single place has to be in one of our eligible categories. Some of them are eligible because there's an exemption in state law. So it's not across the board that every single place has to be licensed or registered, but our places generally fall into two different categories: group settings and community-based settings. In a community-based setting, that's where most of you will see a lot of effort being applied for people that are getting into permanent supportive housing is community-based settings. People have their own lease and the option to prepare their own meals. That's the definition of what we would consider a community-based setting. Every single place has to be either licensed or registered, tribally certified, or have an exemption in statute. And a lot of our supportive housing falls into what we would call, or what is an exemption in our state statute. And you can see here, and I've highlighted, these are all the things that you can see on this chart are eligible categories for housing support payments to flow. They all look a little bit different. Some of them are community-based, some of them are group-based. I'm not going to go into major detail on this, but what you need to see is, as you're serving people who are experiencing homelessness right now, these might be the likely places where people might end up. Board and lodge settings, board and lodge with some supplemental services. We've had a lot of places that are using the hotel restaurant license right now to provide effective shelter for people during this time of COVID. And it's really actually driven quite a bit of innovation. So and partnering housing support together with other funding streams can really work well in a hotel model as shelter. People are going directly into supportive housing or long-term homeless supportive housing, depending on the pathways for people. So it's just important to know that these are the ones that you might be most likely to experience or help a person navigate through. But I think one thing that's important to point out is that our board and lodge settings can be part of the homeless response system, because not every single time is a person interested in going directly. It might be that a person is very open and interested in going into a board and lodge setting and then having a pathway that's through a board and lodge into permanent housing. So it's not, and I'm not saying that it has to be that way. I'm saying that the pathways are endless for people to make. Oh, hold on here. Forgot to set myself to do not disturb. So the pathways could be, there's a wide variety of pathways that a person could experience to get into a place where they're using housing support. One of those categories is supportive housing. And it's important to know that there's some additional documentation that's needed for people that are in a supportive housing setting. Again, people are applying and submitting documentation to support their application with the county or tribal financial assistance areas. In supportive housing, there's some additional documentation that needs to go along with that application. So people need to have a habitability inspection in supportive housing settings. Well, this is where people have their own lease and they're out in the community. And it's because there's no license for that place, there needs to be a habitability inspection that can be done by the provider that's serving that person. That gets submitted with the application, and that's part of, it's an eligibility factor that helps turn on housing support. And then people that are in long-term homeless programs need to have the LTH verification form, and they need to have also documentation from either the coordinated entry system or on a limited basis or a really targeted basis. DHS has the authority to approve some direct access programs that would where people can go directly from the program from one place into an LTH supportive housing setting. An example of that would be for people that are in the transition from treatment model or in residential behavioral health treatment, and they don't have housing instability. We're at a point of engagement with that person. So that person can go directly into a supportive housing, an LTH supportive housing program without necessarily having to go through coordinated entry. That's a broad DHS direct access. So every single time it's not coordinated entry, it has to be through a DHS direct access program. Question, how can I find a housing support provider? This is a big question that comes up, and it's come up a lot over the years for us at DHS. And it's driven the creation of some tools that are new and at the state level and at the county level. And I want to just talk through these real quick. I'm not just going to spend much time on them. New tool called HB 101 Places is one that we are working on right now. It's been launched, but it's kind of in its infancy stages. Hennepin Housing Key. Take a look at those resources. I've already talked about coordinated entry and DHS direct access. So it's just know that there are ways for people to find housing support providers. Increasingly, there are ways for people to find housing support providers. It's really important to know that housing support can also work for families. If a lot of people have a perception that this is just for single adults. It does work really well for single adults, but it can also work for families. Eligible adults can receive housing support and MFIP together. Housing support recipients that receive MFIP, they always pay $146. That recipient pays $146 towards their housing expenses. Even if their family size and their MFIP grant gets bigger, people can use people are always going to pay $146, and then they can use their remaining income from their MFIP grant, including the MFIP housing grant, as long as they're not in a HUD-funded building. They'll get or a HUD-funded project. They'll get the $110 housing grant, and they can put that towards their additional housing expenses. Another thing you might hear from people on housing support is that they don't want to give up their SSI, which is a very regular conversation that comes up. And this is kind of getting to the heart of transitioning to thinking about MSA, is that housing support may not be the best long-term fit for everybody. It's possible that somebody might start with housing support, and then you could message this with people and say, listen, let's just at least get you into housing, you can use housing support to start if you want to. And then that actually, as you'll see, as John talks through this, that actually creates the eligibility for MSA housing assistance for a lot of people. So I'll let John cover that in just a minute. But this is where we're starting to think about transition here. Think about this transition in context. What happens for this person who decides, let's say there's a person who's in a long-term homeless supportive housing setting, and they're getting the housing support room and board and the services from their long-term homeless supportive housing provider. And they say, you know what, I don't want the housing support anymore. So you can see the housing support goes away, and they want to transition to MSA housing assistance. Well, now because housing support went away over here, the housing support service funding went away over here, because that always goes on top of the housing support room and board. But what the news is today is that doesn't necessarily leave that person without services. Now we can say, okay, there's a better way to pay for housing for this person, and they've still got access to housing stabilization services that are not connected to their housing funding stream. And this could look even different. It could be that a person wants to use housing support room and board only, or they get referred to a housing support room and board only program, like a regional effort where they're paying for room and board only, or the program administers as a room and board only, and they get services from a housing stabilization services provider. The point is that the pathways for every single person are going to be a little bit different, and there's a limitless, well, I shouldn't say limitless, but is a much wider pathway or many more options or many more pathways for people to get into housing and maintain their housing over time. So in a second, I'm going to turn this over to John. But this is, in fact, let's just stop here. And before we get to the next slide, I'll let John take it at the next slide. In fact, actually, I'll talk about this slide real quick. The difference between MSA and housing support is that this MSA goes directly to the person. And John will talk about these amounts and how people are eligible for it, but it goes directly to the person, and then they are the one that's in charge of paying for their housing, which is a part of the conversation about transitions with people. So I see a couple of questions that are in here, and I'm not sure if people can see what's on my screen right now, but I'm just going to go ahead and answer these. Okay, actually answer live. Okay, can you briefly talk about the impact the waiver was used for the 18-day absence? Okay, so the question is about the 18-day absence waiver. That is not continuing, and I'm not aware of any discussions about the 18-day absence waiver continuing. It ends on December the 30th of this year, and we're actually, stay tuned for some more information to come out about that. And then I'm going to move on, and just in the interest of time, make sure that John has plenty of time to talk here, because we've got 30 more minutes, and I want to leave some time for questions at the end. So John, I'm going to turn it over to you, and you can go.
Awesome. Thank you, Jeremy. And thanks for setting that all up. So Jeremy went through this slide here talking about MSA housing assistance and what a contrast it is to the housing support program. It provides eligible person with more resources for housing than they would receive under the housing support program, and greater autonomy and control over how that money is spent. The individual receives it, not a vendor on the person's behalf, and decides how to spend that money. They can live in an apartment of their choice, decide how much they want to spend on rent as a portion of their total income. And basically, it just gives people so much more independence and autonomy than they have under housing support. So I want to talk about Minnesota Supplemental Aid and about Minnesota Supplemental Aid Housing Assistance. MSA is a program that is available to people who receive SSI disability benefits, Supplemental Security Income Disability benefits, or who would be on SSI, but they get income from another source. And typically that is going to be from the RSDI program, which is, I'll talk about the differences between these programs. But I want to talk a little bit about Minnesota Supplemental Aid as a program before I get into the details of how housing assistance works. MSA, Minnesota Supplemental Aid, is a Minnesota program. It is funded by taxpayer dollars. There's no federal money that goes into the MSA program, that exists to basically give people on SSI a little bit more money each month than they receive from the federal government. So you know that if a person's on SSI, the most that they will receive is $783 a month. And I'm actually going to go on to the next slide, Jeremy, and talk about, I'm trying to look at my slide here. You know that people who are on SSI get this $783 a month. Nobody who receives SSI benefits gets more than $783. And MSA is kind of a recognition that that isn't enough money for most people to live on. And so we give people a little bit of additional money if they're eligible. In Minnesota, the MSA benefit is $81 a month for most people. It's cash assistance. It goes to the person. They can choose how to spend it. It totals about $1,000 a year, so it's not an insignificant amount of money. It's a nice little chunk of extra money for people. But there are ways for people to get a little bit more, and we're going to talk about one of those ways, Minnesota MSA housing assistance, in a moment. I want to talk first, though, about eligibility for MSA. A person isn't just eligible for MSA because they're on SSI benefits. That's one of the critical necessary things that they have to satisfy in order to become eligible, but it isn't the only thing that they have to do. A person gets on MSA because they apply for it, like the slide here says, and Jeremy talked about applying for benefits before. In one of the questions that I answered, I talk about how a person goes about applying for benefits. There are a bunch of different channels. You can apply online through what we call Apply MN, and the link to do that is here in this slide. Or a person can download the combined application form from the DHS webpage and fill it out. They can either mail that to their county, fax it to their county, put it in a Dropbox at their county. If the person's already open on one kind of assistance, maybe they're receiving general assistance or they're receiving SNAP food benefits, then they don't necessarily need to fill out a new application. They can let their worker know if they think they're eligible for MSA, and then they can add that program. But people do have to apply for these benefits in most cases. To open a case and then start receiving benefits, you have to do an application. Now, I have a picture of the combined application. Many of you have probably filled this out with clients before. It's a long and ugly form. The critical information that you need to remember is that this first page of the combined application needs to be filled out with the person's name and address, or indicate that they're homeless. And you have to identify a category of assistance that you're applying for. And here in the middle, you see there's a blue arrow that shows that what programs are you applying for? Food assistance, a cash program, emergency assistance, you have to indicate whether you're applying for cash or food or emergency assistance. And MSA, Minnesota Supplemental Aid, is a cash program, as is housing support. So you'd want to check that box for cash assistance or cash programs. The client doesn't necessarily need to know the name of the program that they're applying for. They can just indicate that they need help with a certain kind of thing. And then the county and financial worker will help that client identify the program that's the best fit for them. If they have a family, that's going to be MFIP. If they're a single adult, it's going to be GA or MSA. If they are moving into a housing support setting, it's going to be a housing support program. So make sure that you fill out that first page. Now, Jeremy, if you could go on to the next slide, we'll show you that another thing for people who are applying for MSA that's really important is to watch for question 24. It's the last question on the combined application. And it asks, if you're an MSA client, if you have a representative payee, do you have a medically prescribed special diet? Do you have a guardian or a conservator? Or do you have high housing costs? If a person checks yes to one of these boxes, the financial worker's job is to ask the client about more questions about this. And if the person is eligible, this can give them more MSA benefits. For example, if they have a representative payee, we can give the person an additional $25 to help them pay for their rep payee. If they have a medically prescribed special diet, there's a form that the person can bring to their doctor. The doctor indicates what diet they're eligible for, and they can get more money to help them pay for that. And if they have high housing costs, it can lead to a bunch of additional questions from the financial worker where the client might be eligible for MSA housing assistance. So we'll talk about that here on the next couple slides, but this is just a slide that shows you what happens if a person gets MSA. They get to keep their $783 in SSI benefits, plus they get an additional $81 in MSA each month on their EBT card. And like I said, it's cash assistance. They can spend it however they want, but it brings their total income up to 864, which is awesome. That's a lot better than 783. And there are ways, like I said before, to get a little bit more MSA if you have a need for any of these particular special need programs. Housing assistance is one of the special need programs that adds quite a significant amount of money to a person's monthly income. To be eligible for MSA housing assistance, the person has to be eligible for MSA. And to be eligible for MSA, you have to either be receiving SSI benefits, supplemental security income benefits. Those are federal disability benefits for a person who's unable to work because of a condition or impairment that they have that is permanent. It keeps them from working to a level where they can support themselves, or they have to be a person who's getting RSDI benefits. RSDI is not the same as SSI. SSI benefits are for anybody who becomes disabled or is disabled. You don't have to work or qualify for them in any way other than having a condition that inhibits your ability to work. RSDI, on the other hand, the Retirement Survivor Disability Insurance Program, is an insurance program. And basically, when you work, you're buying coverage under the RSDI program by paying taxes. So, if you work, you have various deductions from your income, from your paycheck. One of those deductions is for FICA. And you might look at this on your pay stub and wonder, what's FICA? Well, FICA is basically a way for you to buy insurance from the federal government. And if you ever become disabled, if you've bought insurance for a long enough period of time, you get your disability benefits from a different pool than the SSI program. And your benefits are not limited to $783 a month. They are based on your earnings over your lifetime. So if you work in a high paying job, your disability benefit will be greater. And if you worked in a low paying job your whole life, your benefit will be less. But your benefits will all come from this insurance pool, not from the SSI pool. People on SSI or RSDI can receive MSA and MSA housing assistance. For people who aren't on SSI, we have to look at their income, however, and decide if their income is low enough for them to be eligible for MSA or for MSA housing assistance. Okay, so you have to be eligible for MSA to get MSA housing assistance. You've also got to be under the age of 65 when you apply. You can continue to receive MSA housing assistance if you're eligible for it after your 65th birthday. You cannot, however, apply for it after your 65th birthday. And if you stop receiving it after you're 65, you can't receive it again. And sometimes this is really a bummer. I had a lady call from Red Wing one day, and she was really upset that her MSA housing assistance had ended. And it ended when she moved across the river to Wisconsin. and she was 66 or 67 years old. She decided she didn't want to stay in Wisconsin, so she moved back to Minnesota. And she wanted to get MSA housing assistance again. And I had to say, I'm sorry, but you can't. You're over the age of 65. If you had kept it, you could have kept it until you were 100, but you moved. Your eligibility ended and you can't have it again. So you can only get MSA housing assistance if you're under the age of 65 when you apply. You can continue to receive it after the age of 65, but you can't start after you're 65. You also have to be able to show that you have high housing costs. And what we define as high housing costs are housing costs that are greater than 40% of your gross monthly income. So let's take the example of a person who receives SSI benefits. Their total monthly income is $783. We don't count the MSA, the $81 in MSA, when we're looking at their income. We just look at that 783. 40% of that is about $320, and that would come from the person's rent and utility obligations. If they pay more than that amount, more than 40%, they're at least potentially eligible for MSA housing assistance. You know who isn't eligible, however, I want to go back to that just for 1 second, Jeremy, who is not eligible is anybody who is receiving a rent subsidy where they pay rent based on a portion of their income, like Section 8, public housing, shelter plus care, HUD 202 or 811 benefits, Minnesota housing long-term homeless voucher. Doesn't matter what it is, what the program is, but if a person's already paying rent based on a portion of their income, like 30%, they are not eligible for MSA housing assistance. You're also not eligible for MSA or MSA housing assistance while you're in a housing support setting. A person can't receive MSA and housing support at the same time. You have to end one program to begin the other program. So there is no overlap between those two. Okay, so many people meet these criteria. They're eligible for MSA, they're under the age of 65, and they have housing costs that are greater than 40% of their gross monthly income. So far, I'm describing a really big group of people. What makes eligibility for MSA housing assistance more narrow is what's on this slide. The person also has to meet one of the categories here, and only one. You don't have to meet all four of these different categories, but you have to meet one of these categories. And I'm going to go through them in detail. First, they could be relocating from an institution such as a hospital, a nursing facility, a regional treatment center, intermediate care facility for people with developmental disabilities, an IRTS program, which is a IRTS is what we used to call Rule 36. It's a short-term, typically up to 90-day crisis setting for people with either mental health or chemical health issues. But a person who's coming out of one of those institutions and meets the other criteria could receive MSA housing assistance. Or a person who's eligible for personal care attendant services, PCA services, could receive MSA housing assistance. PCA is a service that's available to people who have certain needs for care. It could be direct care for their person, or it could be care in their home, something that helps them continue to live independently. But eligibility for PCA services makes a person potentially eligible for MSA housing assistance. You don't actually have to have a PCA, although it's great if you do. You just have to show that you are eligible for PCA services in a particular period of time. Or a person who's on a waiver could be eligible for MSA housing assistance. A waiver is a way that we pay for certain services for people with various kinds of disabilities. There are a lot of different waivers, and it doesn't matter to MSA housing assistance what waiver the person is on. They just have to be receiving waivered services. They can't be just eligible for the services, not receiving them. They can't be on a waiting list for a waivered service. They have to actually be receiving it. It could be from the developmental disabilities waiver. It could be from the CADI waiver, which helps people stay out of hospital or nursing home settings. There are brain injury waivers. There are a bunch of different waivers, but anybody who's receiving those waivered services, who's on SSI or eligible for MSA under the age of 65 and has those high housing costs could be eligible for MSA housing assistance. The last way to become eligible for MSA housing assistance is to be transitioning from a housing support setting. And housing support, transition from housing support, it's a new thing. This started on July 1st of 2020, so we're still figuring out some of the details about this. But a person who is leaving housing support can go into the community and use MSA housing assistance to pay for their shelter costs. This could mean that the person is leaving a setting. So Jeremy described places like board and lodges, board and care homes, places where housing support is used to pay for the person's room and board expenses. They could be moving out of that setting and into an apartment in the community and using MSA housing assistance to pay for their room and board costs or for their housing costs. So they could actually move physically. They could also, for some people, not move physically. There are people who use housing support today in, for example, in long-term homeless supportive housing settings, who are living in apartments in the community now. And take the example of a person who's on SSI who is living in a long-term homeless supportive housing setting in the community. Maybe they don't like giving all their money to their provider or to their landlord and just living on $104 a month. They could choose to stop using housing support to pay their rent and start using MSA housing assistance to pay their rent if they're eligible. And they don't have to move to a new apartment. They stay in the place where they're at and they just change the program. So transitioning from housing support doesn't have to mean moving, although for many people it will mean moving. It could mean staying in the same place and transitioning from one program to another program to help pay for the rent or for the housing costs. So if a person is eligible, if they are under the age 65, eligible for MSA, meaning that they're either on SSI or they're a low income RSTI recipient, and they have those high housing costs, and they meet one of the criteria on this slide, then what happens? Well, if they're eligible for MSA housing assistance, we give them extra money to help them pay their housing costs. And right now, that's $392 a month. It's half of the SSI benefit amount, which is 783. So if you divided 783 in half, you'd get 391.50. We rounded up to 392. That's how much the MSA housing assistance benefit is. When SSI increases, the MSA housing assistance benefit will increase. Not right away, but it increases. We also let that person keep the $81 in MSA that they would have received ordinarily, whether they lived in their own apartment or not. And that brings the person's total income to $1,256. They get $473 from MSA, $783 from SSI. They have a total of $1,256 in income. That's a huge increase, almost 60% over what they received on SSI alone. And that gives that person a lot more choices in terms of where they'd like to live. So a person who maybe had a roommate could live alone. A person who lived in a studio apartment might be able to afford a one bedroom. A person might be able to live in a neighborhood that's more expensive than the one that they lived in before. They might decide that they want to make different housing choices than they've been able to before because now they have more income with which to do that. One caution that I want to warn you about is if you help somebody move from housing support onto MSA housing assistance, or even if not from housing support, but just when they go on to MSA housing assistance and we give them more money in MSA, that money gets budgeted in their SNAP budget, their food support budget, and their SNAP benefits will go down. This is something to warn your client about. They will always be better off with MSA or MSA housing assistance, but they will see a decrease in their SNAP benefits. And it's hard to say how much that will be because it really depends on the person's circumstances. There's a lot of things that go into the SNAP budget in determining how much the SNAP benefit is. But when MSA goes up, SNAP typically goes down, and it can go down a lot, it can go down a little, but I just want you to know that so you can warn clients about that potential thing happening. Okay, I know that I went through this very quickly, and Jeremy and I anticipated that there would be a lot of questions from people in the session about how people make the transition from housing support to MSA housing assistance, because this is tricky. Moving from one public assistance program to another isn't the easiest thing to do, and we want to make sure that people do that seamlessly so that when one source of funding, for example, housing support, ends, that another source, MSA housing assistance in this example, begins. We don't want people to be left for a month or two where there's no funding coming in, because then how will they pay their rent? So we want to talk about that. The most important thing that you need to do if you're planning for a transition like that is to plan ahead. Counties that you're working with, like when a person has assistance through a county, the county needs at least a full month to act on any kind of change like this. So if they're going to turn housing support benefits off and turn MSA housing assistance benefits on, they need at least a month of warning to do that. You can't call the county up and say, hey, it's the 28th of the month and my client's moving into a new apartment on the 1st. Can he get MSA housing assistance? That is not going to happen. So you need to plan ahead and make sure that the county has lots of time to take action, and at least a month. You need to consider whether the person is moving out of a facility like a housing support board and lodge or a board and care home, or are they in a place already like a housing support program where they're in their apartment, and you have to consider whether the person is going to be able to manage all of their business on their own. Like Jeremy described before, in the housing support program, we pay most of the benefits to a vendor who then pays the rent on the person's behalf. With MSA housing assistance, the money comes directly to the client, and then they have to be responsible for paying rent and utility expenses. Is the client able to do that? Do they have the skill set and support to be able to do that consistently? Because if they don't, they're going to lose their housing. Another thing to consider is who's going to continue to provide services, or is this client going to live with no support services? Are the services going to come through a waiver, or are they going to come through housing stabilization services that Jeremy talked about? Because when housing support ends, the housing supportive services are going to end for that client. And what is going to take their place, if anything at all? Will you continue to work with that client, or is the client completely on their own? Are they going to transition to a new supportive services provider? But think about what is the service context for that client. For MSA housing assistance, I have a bullet here that you need to talk to the client's financial worker. It's really important to give the financial worker everything that the worker needs to determine eligibility for MSA housing assistance. That means that you have to be responsible for getting all the evidence of the person's housing expenses, their eligibility for the program. Give that all to the financial worker so that they can make a decision about eligibility. And last thing I want to say is just communicate with the landlord. You don't want the landlord to be surprised when a person goes off of housing support and onto MSA housing assistance, because the landlord is going to stop getting a check from your agency and start getting paid in full by the client. That may cause the landlord some concern or trepidation. And what's going to happen if that client doesn't pay the rent, for example? What kind of communication do you want to have with the landlord about whether if the client comes up short some month? With that, those are just some of the concerns that I want to raise with you. There is no form, for example, that you use to like send into the county to say, hey, I want to transition from one program to the other. It's really going to depend on the county that you're in. And I would really emphasize communication with that client's financial worker or with the team that services that client's case to make sure that there's no surprises for anybody, for the financial workers, for you, for the client, or for the landlord, all the parties that are involved. Jeremy, do you want to hop back in and see if there's any questions that we can answer here at the end?
Yep, I'm here for questions, and sure, happy to do that. And before as we do that, I'm going to put our contact information on here.
Yeah, there's a question here, and I'm going to answer this one live from Melissa. And she's asking, I have a client on GRH who received SSI. The client does not want to use GRH as they don't have any money left over. They do have money left over. They just have $104, which means that in their perception is they have no money left, right? They don't want to pay all their money to the client. Can MSA housing bring more income for the client? Yes, absolutely. And that's what I'm describing. If that client's using housing support now, their budget is a lot less than their budget would be if they were on MSA housing assistance. Remember, I showed you on that slide that their total income, if they're on SSI and MSA housing assistance, is $1,256. That's a lot more than the 934, Jeremy?
Yeah.
934 that they have to work with when they're on housing support. So that's probably almost, I don't know, what's that, 30%, 35% more. So
Yeah.
folks who have housing support and move on to MSA housing assistance are going to have more money to work with. That sounds like a good option for the client that you're working with, Melissa.
The only thing I would add to that is that it's there's a real messaging component to this with people about what they're getting when they're receiving housing support. I recognize, and I think it's very true, that for a lot of folks, when they are receiving SSI, there might be a better package for them. If housing support, or I'm sorry, if MSA housing assistance and housing stabilization services may be a better fit for them. However, in terms of messaging with people, when they're giving their SSI income up, they're getting for some people it's a winning argument, or it's a persuasive argument to help them understand that you're leveraging that 783 or that's 679 that they have to pay in to get 934 in value back. That doesn't necessarily persuade everybody, but for some people, if they understand that what you get in return for that is something that you otherwise wouldn't have access to. So it's just important to know. But that's back to the issue of like it's every single person is going to be a little bit different, and it could be that that person really likes their provider, and once they understand the nuances of housing support and what they get, then they like that. Or they might say, you know what, screw that, I'd rather do MSA housing assistance, and that's totally fine too. It's just about what
Right.
what's going to work best for that person, and what their skill level is to be able to maintain that.
Right. Hey, one question here I just want to answer real quick. So Heidi asked a question: if a person's getting housing support and then gets approved for SSI or RSDI and they get back pay, does that get paid back to the county for their housing support or GA benefits? Yes, it does. For any month in which they received housing support and then they later receive SSI or back pay, we automatically recoup that from their back pay through a process called interim assistance recovery. If the person gets awarded RSDI, what's also called SSDI, that doesn't happen automatically. The person's not obligated to pay that money back, but they have it's a voluntary repayment. If it's SSI, it comes out of their SSI back pay automatically. They don't have any choice about that matter at all. They have to sign that interim assistance agreement that allows us to do that. Otherwise, they don't get housing support, they don't get GA, they don't get anything.
Here's
Jeremy,
a good
you want to
question.
take one of these other questions?
Yeah, there's a great question from Catherine about people transitioning from residential treatment. Does that make them eligible for the MSA housing assistance, assuming they would otherwise qualify for MSA? So the transition for a person who is in, let's say a person's in residential behavioral health treatment and they're already on SSI, they could use MSA housing assistance immediately. They could go directly from residential behavioral health treatment. Theoretically, they could go directly from residential behavioral health treatment into their own housing and use MSA housing assistance. There's not a requirement to pass through housing support. That, as John talked about, that can take some planning, and that might not turn on a dime. And oftentimes there's a lot of unknowns when a person is sort of nearing the end of their time in treatment. So if a person doesn't have stable housing locked up, they can use housing support, and housing support itself, if they're going to, two pieces. If a person's in residential behavioral health treatment and they want to go directly to MSA housing assistance, they would have to meet one of the other bases of eligibility that John talked about getting either eligible for PCA services or getting waivered services or exiting. They would be eligible based on the fact that they're exiting from an institution, I guess. So they would potentially be able to do that, but there's some administrative coordination that needs to happen. The housing support transition from treatment basis is there for a person if they need that, and that basis in itself creates the use of that basis of eligibility for housing support is in itself a basis of eligibility, or meeting a basis of eligibility for using MSA down the road. So I think it could be either way. It just depends on how soon that person wants to use MSA housing assistance, and do they know where they want to live. Anything to add to that, John?
Yeah, I guess we could get into the weeds on this. There's a little more subtlety, I think, to my response about what their institution they're leaving from,
Sure.
but I don't think we need to get into that. Maybe Catherine, if you want to email me directly, we could talk about that. But Jeremy, you want to answer this question about the PSN?
Sure. Yeah. Okay. Let's look at this here. Two-part question. 2 boxes needed to be checked to receive housing support. Which ones are they? Okay. So the first question on the PSN. So when I'm referring to 2 boxes need to be checked, so people need at least 2 of the 4 supportive services that are available through housing support, and there's a box that specifically lays out what are the 4 available services through housing support supplemental services. People just need 2 of those. So it's not that there's 2 different boxes. It's that when a qualified professional is documenting services for a person, they need to check all that apply. And if a person needs 2, then that will create the eligibility for that person. The second, to not duplicate housing supports with housing stabilization, which boxes on the PSN should be kept in mind. Well, the box, it's not about the box. It's about within. If you look at the professional statement of need, and there's the one section that talks about our housing support supplemental services, the first bullet point is very duplicative of the Medicaid housing stabilization services, because it's about tenancy supports, all that universe of stuff. And I don't want to go into detail on it, but that's the one where you need to think about duplication a little bit into the second bullet point, because that has to do with coordination of services in general for people, I can't remember the details on it, but in any event, the first bullet point is the one. But I honestly, it's really about the documentation that you're not duplicating than which box it is that's checked on the PSN. That's the story. It's a pretty nuanced answer, so we can talk more about that if we need to. And we're at 10:28. Yeah, I think we're right at the end
Rhonda
here.
had something at the end here.
Rhonda, do you want to chime in with anything at the end?
Yeah, well, if you guys are done with Q&A, I just wanted to thank you both for providing all your insights to everybody attending the VLS, and thank you for being so responsive and insightful in your presentation. It was really a great learning experience for me as well. I just want to give a quick preview of our 11 o'clock session. We will be having folks from Minnesota Housing who will be sharing more information about housing infrastructure bonds and bonding to create affordable housing in Minnesota. So join us for that. And thanks again to Jeremy and John for being with us this morning, and hope everyone has a great weekend.